Welcome to another episode of Virus Decode. Now, as COVID-19 cases see a dramatic increase across the country, we bring you this new show where the print team and health experts, all of us get together to decode causes, impact, and preparedness in India for you. Today, we have with us Dr. Jayaprakash Muliyil, Chairman of Scientific Advisory Committee and member of the National Technical Advisory Group on Immunization in India, Dr. Rakesh Mishra, former director of the Center for Cellular and Molecular Biology, and our in-house expert, Abantika Ghosh, who will answer all your questions and decode this virus for you. Thank you so much to all our panelists for being here and joining us today. Now, my first question is for you, Dr. Muliyil. So if you could just tell us now, for the past 2 years, we have lived in a sort of a predictable cycle. How many more such cycles do you think will be there?
The cycles is quite unpredictable. For a measles, for example, has had probably several hundred cycles. So this is a characteristic of different diseases. What we encountered was a peculiar situation of variants after variants, each with a slight difference. So far, all the variants have been of similar immunological category. In other words, if infected by one, it prevented the infection by next one. This is the first time we are getting a new kind of a virus, so to speak, not a good term to use, which sort of seems to ignore all the previous immunity. It is, from a point of view of infection, a kind of dangerous thing. But for some reason, this also brought about a major change in the pathogenicity and the virulence of the disease. As a consequence, if you may ask me the question, how many more cycles? Now, cycles is a difficult term to define. I guess I have to say, this particular virus may coexist in this fashion or a slightly modified fashion for many more years to come.
All right. Another question that I have is for Dr. Mishra now. Now, Dr. Mishra, there's a perception that there is less lung damage with Omicron. How much truth is there in this statement, or do you think it's too early to say that?
No, there are reports, definitive reports that this virus attacks the upper respiratory tract and lungs are not that much affected. And that is why you see people don't need so much hospitalization. It turns out milder, and also oxygen levels are not so much a problem. But having said that, that doesn't mean that it's in the same respiratory tract. So we shouldn't take any of these things lightly. But this is true that while it has become very, very infectious, phenomenally infectious, but it also is milder. And before people know that they are sick, they transfer the virus to other individuals. In fact, that's primarily the selection pressure for any virus, that it should always try to be more infectious. Then only it can replace the existing variant. Second thing, it should be able to fool the immune system or the vaccine so that it can infect more number of people. And looks like this variant has achieved both. Viruses don't have selection pressure for making us sick or killing us. So that comes as a baggage. If we are lucky, it will be less. If we are unlucky, we may be in more trouble. So far, selection is going in a natural direction, and eventually we should end up with a virus very infectious but very mild, so it can become like common cold or something, and then we don't have to worry about, we can come out of it. But please remember, with such an infectious virus, variants will keep emerging because that's the basic mechanism of the virus, and anytime it can be more troublesome. So we have to be very, very careful and not take it lightly, even if it is it has very mild symptoms that 70-80% people don't know they are infected.
Of course, but there's a speck of hope in your answer, which I really like. Abantika, coming to you now, we've of course seen a lot of frontline workers being affected in the past 2 years as well. Do you see the numbers rising amongst doctors once again? What is the trend that you're noticing?
the numbers are already very high among doctors. A few in Delhi alone, by some estimates, something like 700, 800, maybe more doctors. Every day I get messages from various hospitals saying this many have tested positive, this many have tested positive. Here, I want to say something. So as I talk to doctors, one thing that everybody tells me is that we have a lot of patients with COVID, not for COVID.
Okay.
Which is that these are patients who came in for something else, maybe a routine surgery, anything, an emergency, whatever. And they got tested as part of the regular protocol right now because COVID is around. And then they got detected. Now, here's the risk in it. So see, we've been talking about mildness. Mildness has many aspects to it. And this is one of those aspects that I don't know I am infected, and I go to the hospital for something and I infect healthcare workers because they're not taking the full precaution, because I have no history of, I'm not, my papers don't show that I'm COVID positive. And that is where a lot of infection is being caught. And that is where doctors are catching a lot of infection. That is a real concern because we can, to some extent, we can ramp up everything. We can get ventilators, we can get beds, we can get everything, but we can't get new doctors. Already yesterday, the health ministry has written to states. Delhi actually had started the process last week. Yesterday, the health ministry wrote to states saying that please rope in MBBS students. So that is, it's a mild disease, but if these are the kinds of numbers we're looking at, even if we are, the last data we have is 4%, 5% hospitalization. Even if at these numbers, even if we are looking at 1% hospitalization, doctors, I think medical manpower is going to be a real problem in the coming days.
That's a little worrisome. And when we talk about doctors, we also have a question coming in from a viewer who's talking about health infrastructure. If Dr. Muliyil, you could take this. This is by Suresh Kumar, who's asking, when will COVID and Omicron reach peak in India? And do you think that states which have COVID beds with oxygen and with ventilator, do you think we have enough infrastructure in India? Will it suffice, is what he's asking.
We do not have the infrastructure to look after if everybody falls sick simultaneously. And that has been the problem. And I think we have not been able to really address it. In cities, it's okay, but we have a larger population in the rural area. And we have a major problem in that kind of a context, that if people do become very ill, we don't have the facilities. Now, we have to now pray, seriously pray, that the percentage we are talking about, like it was mentioned, that even as 1% means a large number in India. Now, so we'll be in trouble if it is even 5% needs, oxygen. It'll be a big number. At the moment, things are looking quite bright. Okay? And I'm not going to put my money on it. I'm just going to say, be careful, guys. This can become a problem. So I think, first of all, that, but infrastructure-wise, I think it'll be a long, long time since the rest of the country probably reaches the level that Kerala has, for example, in terms of infrastructure. So I'm saying it is nothing unreachable. It is just that we have to sit and plan and implement.
Of course. Dr. Mishra, a similar question for you as well. I know you've spoken about this before, but like a big takeaway from the first two waves was our unpreparedness in terms of health infrastructure. There were oxygen shortages, SOS calls for hospital beds, ventilators. Again, the same question for you. Do you think we have amped up infrastructure a little bit, at least from last year, and do you think we are prepared?
We are certainly prepared, but to the scale that to some degree, not as Dr. Muliyil said, if everybody falls sick, we'll not be able to manage. No country can manage actually. So there's a limitation, but certainly our health infrastructure has to improve. At least this pandemic has given us that lesson. But I can say that compared to previous waves, this time, taken that this virus is very infectious and so on, but we have the protection of immune seropositivity, which means natural infection. 70-80% people show positivity, which means there's a lot of immune response already sitting in most of the people, and a significant number. We must appreciate the vaccination that has taken place, 1 dose or 2 dose, and now from today, 3rd dose, at least for some. So that certainly provides protection. So which means that even if virus is very infectious, in this situation, we might not be so much desperate for the hospitalization. And as you discussed in the beginning, this might not be leading to a lot of oxygen requirement, because that was the big problem last time. So there are many good things to expect that we'll not face this kind of problem. But having said that, I always bring this concern that this is a virus which mutates fast. So if it acquires something which trouble us more, we might end up in trouble. So that is why we have to be extremely, extremely careful. All what I said sounds very positive, that the high seropositivity in vaccination and better infrastructure and mild, but all this can go to toss if the virus acquires some more killer clinical phenotypes. So that is why we have to be, at the moment, I don't think we have to press the panic button. We are okay. But if we can manage this little bit, take care, create as many roadblocks for the virus to spread freely as we can, we might come out of without much problems.
So since you,
yeah. So I have a question for you, Dr. Mishra. There are reports coming in from Cyprus of something called Delta Cron, which is a mix of Delta and Omicron. And there are some experts who are saying, no, this is not, it's just an error in the analysis. What is your take on this, sir?
It's very, very unlikely that because this virus, although it mutates fast, it doesn't recombine with many things. So that's unlike flu and all. So that looks very unlikely thing. And the way these analyses are done, in fact, we don't talk 1/3 of the cases, we don't assign any lineage because we don't know what they are. So like that, there are a lot of, it's a very heavy data analysis, and this kind of thing can happen. I'm sure that I shouldn't say I'm sure, but most likely that's not going to be something of the kind where Delta and Omicron have combined. And please remember, they combine doesn't mean that they will be 1 + 1 = 2. They may become less effective also, because number of mutations don't decide that it will be more effective. It is what has changed and what combination it has changed. So first of all, it's unlikely to happen, and even then, I don't think we have to immediately worry that it will be very dangerous. But as I said, virus is under pressure to break the immune system. Vaccine breakthrough and escape immune system and be highly infectious. So these things are already not something that we can take easily. But if it acquires something more troublesome, we will be in trouble. So that's why we have to respect the virus and keep it off, or not let it go wherever it wants to go.
Dr. Mishra, just a follow-up question on your previous answer. You mentioned that you said that we should create as many roadblocks as possible for this virus. What do you think would be, if you could give us a list of a few such roadblocks? Do you think night curfews and these weekend lockdowns?
I don't know. Night curfew, I don't know what does it do. I'm not very sure of the utility, except the psychological thing that something is around and we should take care. Otherwise, I don't think it matters much. There is not much nightlife in most places. And so that is maybe just a psychological thing. But roadblock we can certainly create, and that is largely an individual thing, which is to wear mask N95 and wear mask properly. It's very unfortunate to see even very highly placed people and representatives of the public don't wear mask, or for the sake of a photograph. That is something not very nice. That doesn't put a good example. So we should put proper masking and not remove it, not touch it. we avoid going into clusters of closed space. Particularly, we know this virus can hang in the air for quite some time. So, and if you're going to public toilets, don't open the mask there, even if nobody is there, because the virus will certainly be hanging around there. So these are several things that we can do. And other thing will be, of course, which government can do or system can do, is to keep testing and isolating, so that once you isolate, then virus can do nothing. So, but you should know that who to isolate. If larger number we test, larger number we isolate, we can defeat the virus. But unfortunately, many people don't get tested, and sometimes unknowingly, because it is asymptomatic, so that is very difficult. So let's assume that everybody is infected and prevent virus from crossing each other. So use the mask and avoid clustering unprotected. For example, going to a restaurant and eating, I would certainly avoid. I'll not go at all. And I think, although it has economical things, but restaurants and those kind of places, if you go, you have to remove your mask. You can't eat with mask on, and that's a crazy thing. So I think we have to control ourselves, be disciplined for a couple of months, and we might come out of this.
We have a similar question coming in for Dr. Muliyil from Pooja Sharma. She's asking, now administration of booster shots has begun in India, as also other steps. She's also mentioning night curfews and weekend curfews. What do you think should be our focus, say, for the next month or so in order to curtail this massive rise in infections?
If I heard your question correctly, two things we are asking. Will additional doses help? Now, the thing is, I think Dr. Mishra already mentioned that we have a fairly immune population because of the natural infection. And also we did give vaccine. But if we look at the experiences of wherever people are mainly dependent on vaccine-induced immunity, additional doses have had only marginal effect. The disease has spread. So the hope that vaccine will reduce transmission is not going to work out. So that is something we have to accept and say, okay. Now the next question is in terms of, how do we handle in the next 1 month? What can we do? And the point we have to remember is that what does the virus do? Now, if you remember the Delta virus, and if you have seen the graph, there is an age-specific curve for mortality. That is, young to the old, this curve goes up exponentially. When I say exponentially, very zero in young children, very minimal in the young adults, middle age a little more, but by the time you come to my age, it's sort of shooting up. Now, this particular virus also behaves similarly, but at a lower level. In other words, the young are really spared, and the older also has a much lower mortality intrinsically. Intrinsically means the virus characteristics do not permit it to harm us because it's mainly an upper respiratory. On top of that, we have this load of immunity. So I think you have to be realistic. On one hand, we would be very happy if we can stop the virus, but the thing is, this particular virus is so infectious, very extremely infectious. And so the hope that we can stop and have a reasonably normal life, these two are not compatible. And then you can't even, you have to ignore all your friends far away. That's not possible. And we have been following up certain populations, and the rate of spread is so impressive. I haven't seen any other infectious disease that spread so far, much faster than Delta. But what I say, now balance this. It's highly spreadable disease, but not so dangerous. So you have to be selective. If I have an elderly friend, I would suggest that keep off the circulation for a little while, or at least be a mask all the time, even though you are vaccinated. Okay? So that is the only way can overcome. I don't think younger people need to worry because it is truly a mild disease when it's come to younger generation.
All right. Dr. Muliyil, in addition to that, there's another question where people are really worried about reinfections. Could you explain to our viewers whether there is enough precedence on how vaccinations or past infections work against the new variant?
Yeah, the thing is, this has been a system all along in our life. Remember this time we used to have smallpox. And you know who took up with a deadly disease? Who looked after people with smallpox? People who had previous infection. Okay, because those people, it is not those days we didn't have much immunology and virology. They knew if you got it once, you won't get it again. Measles, if you get it once, you won't get it again. But this particular virus has been changing as a bit, but not enough to ignore previous immunity. This is a new virus in that context because it is an immune escape virus, so to speak. The former immunity it ignores. But then something else, the body steps in. Body has been exposed to similar virus and body says, hey, this guy is similar to the one I have seen and I'll fight him back. And that is other reason why the clinical pattern is much milder. These two things synergistically seem to help out.
All right. Okay. We have another question coming in from a viewer, Kumar Satyam. If Dr. Mishra, you could take this. He's asking, how effective is RT-PCR in detecting new COVID variant? Is antigen test also helpful in detecting a COVID variant?
Antigen test is not for COVID variant because that does not read the sequence which typically is used for variant detection. RT-PCR tests are good. But please remember that RT-PCR test sensitivity also is about 80% or something plus minus depending on which kit you are using. So 20-30% you might miss out even if the person has little bit lower load, early infection and so on. So that is why testing negative doesn't mean that you have now license to go and freak out. Always, as I said, please consider that you might be infected. Dr. Muliyil said that young people are safe, they are okay, but they can still infect the elderly people in the house. So they also have to avoid, they will not get affected, but they will encourage the virus to go around. So, coming back to RT test, now the only sure way of detecting the variant Omicron or whichever is by sequencing, which is expensive and time taking. But now the kits are being developed, and I understand that some will soon come into the use, whereby RT-PCR itself, you can tell whether it's Omicron or not. Now also we can see this, the spike gene dropout is one way, but that is a negative thing. It doesn't confirm something, so it's generally suspicion. But the kits are now made where you will see a signal only if it is Omicron and not if it is Delta or something. So those things will come, but at the moment, RT-PCR remains the most reliable thing, and but we should take it with a pinch of salt that sometimes kit can miss out if the viral load is less or something else can go wrong. It's a pretty sophisticated test. You are isolating this RNA from the virus, which is biologically very unstable molecule when it is outside. And then you are converting that into DNA. Then you are converting, doing a polymerase chain reaction on that, and you detecting where fluorescent probes is a pretty sophisticated thing to do. So any step can go a little bit wrong and you may miss out. So we should keep that in mind and take precautions.
Dr. Muliyil, I have a question for you. If you could talk a little bit about the decision to call this third shot that we are giving, we're calling it precaution dose rather than booster. Can you sort of explain the difference between the two? And also the decision to administer it from 9 months after the second shot?
Well, this is a decision made by competent people, and I think it is out of the the rationale is not very clear from a basis of immunology. But you see, whenever you give vaccination, not all respond positively. There may be drug treatment, there may be some other illness. So the point is, we are quite satisfied that young people are pretty competent to deal with an infection. The elderly, the doubt is, did everybody get a good immune response after the first 2 shots? Since if they have not, this precautionary shot may top it up. And that is a belief that probably is based. Okay, so it is not without logic, but in general, I think it is targeted at people with some comorbidities or extreme age.
We have a viewer question coming in. His username is Storytelling by Prashant. He's also a member of our YouTube community. He's asking, and Dr. Mishra, if you could take this, I think you referred to this a little bit in your previous answers. He's saying Delta was deadlier, Omicron is lighter. Is there any trajectory of virus, and can we expect next variant to be like Delta or Omicron?
It's very dangerous to make such predictions because the mutations are random, and whatever makes the virus more infectious will survive. That is very simple rationale in that. Next survival thing will come if the virus is able to escape the immune protection that we have acquired and can cause a vaccine breakthrough. These are the positive selection. The rest is our luck. Virus may come with bad symptoms or good symptoms. If it comes with bad symptom, that will not go very far because people will fall sick, they will move less, and the virus will be less efficient in spreading. If it is milder symptom, then people will unknowingly keep spreading. That's why the natural tendency is that it will get milder and milder and more infectious. So after some time, it will become like a natural part of our life. But as I said, it's a random process, and you might get a little surge somewhere of a nasty one, which can damage the people. So while general selection pressure we can discuss, but mutation is random and we can't predict that next one will be Delta or next one will be Omicron. If you, if you take an average over a long period of time, it will be maybe milder than Omicron, but that doesn't mean that milder will be the next one. It might be the nth one after this.
All right. Prashant also has a follow-up question on the same question. He's asking, so many people are now getting infected. Isn't it the best condition for more variants to come up?
Absolutely. Variant is, that's what the whole idea is, that if more people are infected, then immediately virus gets, each infection gives a chance for virus to come up with new versions. And if more people get infected, more variants will come. So that is what is the risky thing, and that's what is I feel is the real danger of this virus. Not the number of cases keep increasing. As long as it's mild, it doesn't matter. People will not know. But that also increases the possibility of newer variants to emerge, and some of them may be bad ones.
All right. We have a question coming in from Sunaina Shah, who, if Dr. Muliyil could take this, she's asking, despite the perception and belief that Omicron is mild, do you think this narrative is relevant for a big country like India with a large population? Because, it's a tiny fraction of a very large number.
Yeah, I agree with you. I mean, you have the numbers and fractions sometimes can be confusing. And I think it was mentioned earlier too, even a small fraction could mean uncontrollable number. That is the issue. We don't have an option. We have to face it. Okay. So given that thing, then I ask the question, how do we go about? Now, there is a tendency, for example, I know some states decided to admit anybody suspected of Omicron into the ward. Now, that will be absolute misuse of your resources because they are not going to be sick and they don't need a hospital. So if you plan your resources carefully and manage it in such a way that you are targeting at sick people who really need, in which case you are never going to run short of beds for COVID, as we did in the last episode. And I think that is the wisdom we need to triage properly and to ensure that you don't get into that kind of a trouble. So the question is valid, and I don't think we can just wish it away. That is a part of the game. But compared to Delta, which was a nasty disease, this is a whole lot milder virus. And waiting for a more dangerous strain is a pastime we may have to indulge in, but that should not ruin our lives today, because that is something beyond our control.
Dr. Mishra, if I may step in and ask you this, there is a theory that because so many of our vaccines concentrate on the spike protein, I heard it very interestingly described somewhere, I think I read it somewhere, about this monogamous relationship with the spike protein, and that is what is causing the virus to mutate so fast. Do you agree with that, or do you think this was, inevitable during a pandemic, so many variants?
No, variance is natural. Variance is not, that is the mutation rate in the virus, and on an average, 2 mutation get established per month. So that's what we have been observing. And in fact, we can calculate back when the virus came to human beings, because we can see what kind of mutation it is having. Those things are fairly established. That is not so much to guess. That spike protein is the main target for the vaccine, and the virus will be, as I was saying, try to break through vaccine. Whatever escapes those antibodies will be more successful. But there is a very strong logic for choosing spike protein, because that is the key virus uses to open the lock of the cell through the receptors. If you block the key, then virus can do nothing. It cannot open, and you are safe. So virus can modify little bit the key, but it can't modify it too much, because if modifies too much, then it will be not infectious at all. So there is a tug of war between the vaccines and the how much RBD or how much overall spike protein virus can play with. That's the beauty of biological systems, that possibilities are many, and it keeps trying, and the virus has advantage of number. Millions and millions and millions will try. Even if one succeeds, that will show up, and rest can anyway are destined to disappear. So that is the game that is happening. But vaccines are working. It's not only that entry of the virus, then other of the cellular immunities, they help us. And so vaccines, in fact, they were not even meant for spreading, stopping the spread of the virus. They were meant for saving the life and reducing the hospitalization. And that I think now word over, it has shown that vaccines have saved a large number of lives and saved people from visiting hospitals unnecessarily. But the spread, as you just heard from other experts, is not the thing. Even if you are vaccinated, that doesn't mean that you will not get infected or you will not spread. Only thing is that you will not fall very sick, which is not a small deal. But at the same time, we should, so vaccine against the spread is the mask, and vaccine, the disease is the real vaccine. If we use both protections, we'll be in much better position.
We have an audience question coming in, which is very similar to what Dr. Mishra has already answered. But if Dr. Muliyil could take this, Prasen Inamdar is saying that many people are still getting infected after 3 or 4 doses, albeit with mild symptoms. But he's asking, is there any change in the booster strength or composition?
No, not yet so far. And that is the same vaccine we are giving. And there have been studies where the mix and match will work, and that is a different talk altogether. But basically, the lesson is very simple, that when you give vaccine, its purpose, as Dr. Mishra said, is to prevent serious illness. That works. Unfortunately, you have to bear with this reality that transmission continues. So additional doses does not offer any wall of protection against infection, truly.
All right. We have one user question from Kumar Satyam, who's saying that he's being unable to find a proper contact information for the print and he has a US issued credit card. He's trying to take a subscription. Kumar, just addressing this, just message me on Twitter or send me an email on apoorva.mandhani@theprint.in and I will give you the details of our backend team and we'll get it sorted. With that, we've reached the end of this episode. A big thank you to all our panelists for joining us. And I think personally for me as well, this episode was very, very informative. I understood you really broke down things till the T for me. As for our viewers, thank you for sending in your questions and joining us, and do keep supporting us the way you do.